Culturally held beliefs around health and illness contribute to an individual's ability to effectively receive care from healthcare providers. These beliefs cause physicians to make generalizations and miscommunicate with patients who have identities that are foreign to the provider's paradigm. One proper solution to this would be to advocate for a more holistic and inclusive medical education for healthcare professionals. However, although this is framed as a matter of cultural competency, it is necessary to go beyond the symptom and confront institutional racism in America. Addressing these challenges entails 4 parts. Taking care of our health should be deemed as acceptable. Making healthcare accessible and affordable for African Americans requires coordinated efforts across healthcare systems and advocacy and activism in the policy arena. Secondly, health literacy, knowledge, and comprehension. Thirdly, accessibility. Solutions to the affordability issue also includes options like having support groups that are both community-based, which also solve a lot of the accessibility and acceptability issues as well. And lastly, affordability. Different types of support all contribute to the strength of social capital for each individual within a community. A characteristic that defines someone's social capital is the type and strength of their ties to other individuals, including bonding, bridging, and linking ties with people of similar or different social characteristics. And linking ties are ties with colleagues in different levels of hierarchies. An online support group that collaborates with other advocacy groups, research groups, state and local politicians can enforce a more intricate vetting process of an online support group as a strategy of intervention to shed a light on user-posted stories about overcoming health barriers and enforcing standards, ensuring that its participants are adhering to the code of conduct throughout the duration of their participation in the online group, which can make it easier for them to create their own identities and promote their intergroup attitudes in their online communities. If we can figure out how effective social support can be maximized by electronic support groups, it can leverage social support, positive social modeling, and dynamic content to keep users engaged in the program and to support behavior change.
Our demands are threefold. Firstly, we would like to expand healthcare insurance. This would ensure that the minoritized and marginalized in our community are granted access to the resources and care that they deserve. Secondly, we would like to change the curriculum and training in healthcare in order to counter medical racism perpetuated by these institutions. By doing so, patients of physicians would be able to receive care that takes into account their experiences and minimize medical mistreatment and mistrust in the community. The third demand ties into that idea of medical mistreatment by educating the public on reporting medical mistreatment experienced in the community. Some community organizing strategies that we intend to use in our organizing campaign are the sponsoring of several community health and disease prevention programs, community advocacy events and volunteer coordination, as well as online calls to action. These have been adapted from previous organizing campaigns in order to highlight structural racism within health education and are powerful tools for mobilizing the community. Here are some of the organizations that are striving to transform the healthcare profession system by challenging how healthcare professionals are trained, as well as how they are held accountable. Feel free to check out these websites if you are interested in learning more about helping the cause. In conclusion, modern medicine may not always consider a healthcare perspective that takes into account the effects of race and ethnicity or the social determinants of health. Ultimately, this issue is not novel in its conception and has been an active reality for many Americans that have been glossed over in the past. Although there have been steps in order to reduce these disparities caused by race, it is important to remember the systems and institutions that serve to perpetuate these situations. Current strategies that address this topic take into account a multidisciplinary approach that considers the larger structures that allow institutional racism to persist. Through community organizing, it is possible to advocate for a more holistic and inclusive medical education for healthcare professionals. Thank you.